Hi, I'm Joshua Harris. I'm joining you today from Baltimore, Maryland, which sits on the land of the Piscataway and Susquehannock people. I value partnership and collaboration. In doing this work, I feel excited to assist you in the great work that you're doing. I'm the Senior Manager of Marketing and Communications for Voices for Healthy Kids, an initiative of the American Heart Association that works to advance equitable policies that make the places where babies, toddlers, kids, and families live, learn, and play healthier. Welcome to Module 1, in Finding Commonalities and Solutions with Decision Makers. This is the first in a series of short modules that make up part 1 of this training. We're doing this so you can watch at your own pace and revisit the modules alone or with your team or coalition as needed. The second part of the training is a live workshop and/or technical assistance. More on that in just a bit. I'd like you first to meet our team. Then I'll share an agenda and an overview on using these modules.
Hi, I'm Ali Rahimi, and I'm the National Grassroots Manager Digital for Voices for Healthy Kids. I assist campaigns with technical assistance related to digital grassroots and communication strategies, including issue education and network activation. I'm joining this event from Carrollton, Texas, which is part of a greater area of land that was home to the Wichita people. I value open-mindedness and sincerity, and doing this work, I feel energized and a sense of purposefulness.
Hi, I'm Laura Coleman. I'm the Media Relations Manager Advocacy for Voices for Healthy Kids, where I guide and support grantees on how to strategically cultivate and manage relationships with media representatives in order to advance public policy initiatives. I'm joining you today from Jackson, Mississippi, which sits on the land of the Biloxi, Chickasaw, Choctaw, and Natchez tribes. I value accountability and self-motivation. Doing this work, I feel ambitious.
And hi, I'm Serene Arena with Metropolitan Group. We're a social change firm working with Voices for Healthy Kids on messaging and movement building. I'm based in Madison, Wisconsin, which occupies ancestral Ho-Chunk land, a place their nation has called Dejop, meaning 4 lakes, since time immemorial. I value contribution, and in doing this work, I feel hopeful. Later on in other modules, you'll meet my colleagues Jennifer Messenger and Sarili Patel.
We just introduced ourselves in a specific way, touching on our values and feelings about this work. This is a preview of an important component of this training that you'll learn more about from our other team member, Anasuya Starbear, in the module on hidden feelings. I encourage you to pause here and think about your own values and how this work of talking with decision makers makes you feel. You can leave this slide up while you pause to give you some words to consider. It's also in your workbook.
This is the first module of trainings for a new resource, a guide to support advocates working on policies that affect the health and well-being of children, families, and communities. This work came out of an initial request from advocates in our network for help customizing messages around prenatal-to-3 policy asks, especially when working with decision makers in conservative states. Because of this, you'll notice that modules 2 through 8 use examples from prenatal-to-3 policy conversations, which we sometimes refer to as PN through 3. But as you will quickly see, the approach and information we share are broadly applicable. In fact, the format's flexibility has allowed us to begin adding more topics to the series, like Module 9 on local decision making. We'll share our research, messages, and audience strategy.
This message resource uses archetypes, typical examples of certain decision-making styles, to aid understanding of what decision makers may feel, need, and value in their work. This vantage point prepares you to find common ground and advance more productive conversation. We focused so far on archetypes for conservative elected officials, since many of the issues we work on at Voices for Healthy Kids face the most opposition in conservative states. As this work grows, we hope to build additional archetypes across the full spectrum of decision-maker ideologies. If you watch the brief overview, you have the basics. These modules in the online guide will take you into the details and tools.
In addition to strategies and messages to help find common ground with decision makers who hold differing views, This training and the online guide offer another unique feature: guidance on how to engage in these conversations in a non-polarizing way that helps you, as an advocate, listen to your own needs and values so that you can be most effective and also care for yourself. We're hearing that this is a unique and welcome component of message training, and I hope you find it supportive as we all do our best work while still taking care of ourselves in order to prevent burnout and isolation.
Here's how we recommend using this resource. Part 1 of the training is delivered through a full set of modules, where you'll hear more from a variety of people who have worked on the research. Modules 2 through 6 are about the archetypes. We'll then talk about ways to create a third space for understanding and conversation, as well as self-care. And we'll share updated messages about 2 specific issues: prenatal-to-three policies and the benefits of local decision-making for policies that improve health and well-being. Altogether, the modules take just over an hour and a half to watch and cover all of the content in the online guide. We recommend you watch them all in order, then return to the ones you want to think more about, or when you need a refresher. If you prefer to read rather than watch and listen, you can skip the modules and thoroughly explore the online guide.
In either case, please use your workbook, which is available in the training section of the website, to make notes and write down questions you'd like to discuss in the live training, if there is one coming up, or in TA with the Voices for Healthy Kids team. Stay tuned for information about upcoming live sessions. You can also visit a community of practice or request a technical assistance session with our team to discuss and workshop these tools. We'll also post recordings of past live sessions so you can see how your peers role-play scenarios with decision makers. We encourage you to come back to these tools, use them with your team or coalition, and let us know how it goes.
Our work is only beginning. As capacity and funding allow, we will add to the library of offerings. Projects are chosen based on real-world requests of advocates. Please dive in, and if there's something else that would help, please ask. See you in other modules, in a training, or in technical assistance.